It was probably about 2 years ago. Mostly I noticed a sensation of a lump down below, which made it very difficult, well, not difficult, but uncomfortable to walk particularly. What made me decide I wanted to have the surgery done was that it was really having a significant impact on my day-to-day life. I couldn't do the things that I enjoyed doing without discomfort.
With pelvic organ prolapse, the uterus or the top of the vagina might be coming down into the vagina. The walls of the vagina might also be prolapsing or descending down. The symptoms could be a feeling of dragging sensation in the vagina. They may be able to see a bulge or feel a bulge in the vagina, or it might be affecting intercourse. They might have some bladder symptoms associated with that bulge. It can have a negative impact on their social life, their mental health, their physical ability to be able to do activities with their children or their family.
The surgical treatment, the options would be a hysterectomy, removal of the womb, which is usually done through the vagina, or keyhole surgery to lift the prolapsed uterus back up into its anatomical position using a strip of polypropylene medical grade mesh. This mesh attaches the uterus to a ligament in the pelvis and helps to support this weakened structure. The recovery times are short and we know that the outcomes are good.
I was seen by the consultant, and again he confirmed what it was and gave me some options, talked to me a little bit about this particular surgery, gave me some information leaflets and some links to various internet sites to go away and have a think about it. I did some reading, I did some talking to colleagues and friends and things, and I decided to go ahead with it.
The most common operation that we perform now for uterine prolapse would be a laparoscopic hysteropexy, because it gives lasting support and the evidence is comparable to a vaginal hysterectomy.
After vaginal hysterectomy, up to 40% of women can develop further prolapse later on in life.
I was given a pre-op assessment date, so I came into the clinic and I had a pre-operative assessment with a nurse specialist who went through my symptoms with me again and then went through background medical information, essentially to make sure that I was fit for the procedure. And that was about a month before my actual date for surgery.
In Oxford we don't put the mesh in through the vagina, we insert the mesh laparoscopically through keyhole surgery, and in over 500 patients in our published data series over 10 years we have not had any cases of mesh erosion with this operation.
The problems that can occur with mesh are avoided because we do not use mesh transvaginally. We are using mesh through the tummy to support prolapse. So by not inserting mesh through the vaginal wall, we avoid the problems that can occur with mesh eroding into the vaginal tissues.
I came in at 7:30 in the morning. I was seen by a team of nurses, I think, to start off with, who again just went through the history, made sure that I was well on the day, you know, fit for the procedure.
The advantage of hysteropexy is that the patient gets to retain all of their own tissue, and we lift the prolapsed uterus back up, and we know that the pelvic floor is weak, so this may unmask some inherent stress incontinence, so this may present as a new symptom after the operation. I think that women who have surgery should weigh it up whether their symptoms warrant the risks of surgery, and we're happy to discuss this with all our women in clinic.
After you've had your surgery, you spend a little bit of time in recovery and then you go back to gynecology ward to be looked after by the nurses, and you have a catheter in your bladder overnight and that's taken out the next morning, and then you recover on the gynecology ward until you go home. You're likely to be in hospital for 1 or 2 nights. I
was up and walking about by the next afternoon, I think, and eating and drinking pretty normally. You know, for a few days you have a blown up tummy and you have 3 or 4 little nicks, little incisions with stitches in your tummy, so it's a little bit uncomfortable to go up and down stairs. But quite quickly I was back to reasonable mobility. That sense of a lump and that discomfort making me walk in a funny way and all that has all gone. My tummy healed up really, really quickly, so I would say I'm back to close to normality.
You will be sent a clinic follow-up for 12 weeks after surgery in the specialist nurses clinic. However, should you have any problems in your recovery, you can phone the specialist nurses directly and we will see you sooner in clinic. You can go back to work approximately 6 weeks after surgery. However, this sometimes needs discussion on an individual basis depending on what you do for a living. We're recommending doing no high impact activity for 3 months. We advise no intercourse for at least 6 weeks. We need to let everything settle and healing to take place and just be guided by how you feel with your body. Actually, if you do too much, your body will let you know you've done too much and then you will need to rest.
Going through hysteropexy has been very successful, not too stressful, and has really changed my life so that I feel pretty much back to normal now. The care and attention I had from everyone, I would say, without exception, was excellent.